Hello and welcome. My name is Mahendra. This short series of videos is all about how to take care of your back. So out of these short videos, the very first video to help you understand how to deal with your back when it is stiff, when it is painful, when it is not comfortable. So how to make your back comfortable. So we are going to see about 5 postures in supine position, lying down position. So position first you make your both the legs straight and very slowly lie down on your back. Now as you lie down on your back, first practice are the moccasin. So you just bend your right knee, hold on to your right knee with your both the hands, bring your right knee towards the chest as much as you can. Press your lower back down on the mat, maintain your left leg straight, press your left heel away from your body. Press the left thigh down on the mat. Maintain this posture for about 15 to 20 seconds. Release your both the hands. Release your right leg. Bend your left knee. Bring your left knee to the chest and hold your left knee with your hands. See how much you can pull it closer towards your stomach. Now depends on your frame, how much flexible you are, how much stiffness you hold in your hip joint. You can bring your knee to the chest. If you find it is difficult, wherever you bring your knee to the chest, maintain there. So release after about 15 to 20 seconds. Maintain your both legs straight. Repeat this posture 3 to 5 times depending on the stiffness in the front of your hips, on your hip flexor muscles. Next posture, bend both your knees. Cross your right thigh over the left thigh. Once you cross your right thigh over the left, open your both the arms, your palms facing down. Then drop your knees towards your left side and turn your face to the right side. Release your practice, slowly release your both the legs. Interchange your both the legs. Drop your knees towards your right side and your face to the left. So try to press your left shoulder on the mat. Try to press your left knee on the mat. As deep as you can, give this gentle twist on your back. It's a very simple, easy and quite harmless stress. So you can practice it as much as your body helps you to practice. If you find your shoulder is being lifted like this, then in that case, first bring your shoulders down and don't bring your knee down too much. So you just twist halfway and stop there. When you find your shoulder is being lifted, stop there. Press the shoulder down and then try to bring your knee down towards the mat. Hold this posture for about 30 to 45 seconds and you may repeat this practice a couple of times. This is moccasin. Now next practice, the eye of the needle. Once you are done with the 2 practices, you are more ready for the third. So here you bring your right ankle on the top of your left knee. Remember, on the top of your left knee, not towards your thigh. Bring your right ankle on the top of your left knee. Then hold on to your left leg with your both the hands. So your right hand moves through your both the legs to grab your left shin bone. Now once you hold your left shin bone, try to pull the left thigh towards your stomach. Keep both the sides of your sacrum on the mat. Left and right side of your sacrum should be very much on the mat. Try to move your right knee away from your body. So maintain this posture here for about 30 to 45 seconds. Then releasing your both the hands, release your left foot on the mat, right foot on the mat. Change the side. Left ankle goes on the top of your right knee. Hold your right leg with your both the hands. Try to bring your right knee towards your stomach. Make sure that you don't lift your sacrum. Both the sides of your sacrum should be on the mat. And for a more effective glute stretch, try to move your left knee away from your body. So do the same with other practice as well. Hold this posture again for about 30 to 45 seconds. Releasing your both the palms. Keep your right foot down, left foot down and make your both the legs straight. Now that was the eye of the needle. Now we reach to the next practice that is a little more challenging that is a little more involving practice. So if you find it is difficult for you to practice without pain, you be very much attentive to the instructions coming ahead. If you find you're comfortable enough, don't force yourself too much. So next practice is the bridge pose, Setu Bandhasana. Bend both your knees and ankles in one line. And then press both the heels firm against the mat. And then observe the lower back. You press your lower back on the mat and you just lift your tailbone a little bit, so that there you give posterior pelvic tilt. Maintain that posterior pelvic tilt. Press the heels and lift your tailbone up, lower back up, middle back up, and bring both the palms down. So inhale, lift yourself up. Exhale and slowly release your practice. So this practice you can repeat a few times, like about 5 to 8 times, and then you hold the posture as you press your feet and roll the hips. Lift your tailbone, lower back, middle back up, then roll your shoulders outward. So you make more space to open up your chest and give a nice gentle back bend on your middle back and upper back. Remember, the lower back has to be rolled. The pelvis has to be rolled. You may clasp your hands together and maintain the pose for about 30 to 45 seconds. When you are done with the time, release both the hands first, then release your upper back down, middle back down, then your lower back down, and then your tailbone down. Release both your legs. Once you are done with these 4 postures, you take a little distance between both the feet. Make sure both the legs are long. You try and roll the hips once again a little more. Lengthen your whole spine. Make more space with upper back and middle back. Keep both the arms away from your body. Your palms facing the ceiling, and very gently close your eyes. So these 4 or 5 postures, including the last Shavasana, if you practice regularly with consistency and with the same given attention, you will find a considerable difference in your pain that is caused because of wrong posture, long sitting hours, long journey, pain that is caused because of long standing hours, or any lifestyle related issues or imbalances that are difficult for you to address in your day-to-day activities. Well, yoga can help you balance. So find these 4 or 5 postures in your daily routine and you will be happier to enjoy your spinal mobility. Thank you.